Hello everybody, Suzanne with Dawning Visions Hypnosis. Today I have a really serious question for you mental health providers. One that is not really particularly easy to confront. And that is whether you get involved in codependent relationships with your patients. Now, I know that you know what codependent relationships are, especially when you're working with your patients on their codependent relationships. But it seems that often there comes a time when some of the relationships that are formed within the practice do indeed become codependent. And the best way that I can explain this to you is when a therapist believes that they have the answers for their patients, or that it's important for their patients to have someone to talk to on a weekly basis, or when you feel that your patient is incapable of dealing with life on their own. Now, if someone is seeing you for outpatient treatment, in most cases, they're not going to need really serious, intensive work to be done. Those folks would be in inpatient situations most of the time. There are times, of course, when some people do not go inpatient and they do have problems and they will be seeing you on an outpatient basis. But we don't want to confuse the patient receiving help and guidance from you and you're becoming codependent on their being in your practice for you to feel good for the help that you're giving, which I call a need to be needed problem. You see, it's not our job to be needed by anybody. Not really. Yes, some people do definitely need to have therapy. They need to have people do oversight over their behaviors because of the problems that they have created in their lives. But in order for these folks to truly get the help that's required, they have to want the help. They have to be willing to listen, to put into effect the suggestions that you give them, to follow the directions. And if they aren't willing to do that, there's nothing that you or anyone can do to help them overcome their problems. It's up to them. All we as practitioners can do is facilitate it. They have to do that work. They have to dig deep inside to get their answers. And when we come across as being needy, having them in the practice for our own sense of self-worth, because I believe that's where the problem is. It's not really about keeping people scheduled for income. People don't generally go into doing therapy to make a lot of money or to become really wealthy. That's not why people do this work. They do this work because they feel called to do this work and it's really meaningful to them to help people. But we don't want this to become a need to have our patients need to see us. We need them to want to be healed. And I actually tell my clients in the very first consultation I have with them before I will even hire them on as clients that there may be times when they will be really pissed off at me because I'm going to force them to go to places that they never did before, and some of it will feel really, really hard until they do it and they find out it wasn't so hard after all, and that they gained so much as a result of being willing to do what I told them they needed to do. Because when I tell my clients what they need to do, it always is from information coming from their subconscious mind. That's where I get the information on what we need to do for their homeworks. I don't just make it up. It comes from them. So we need to be able to understand how to create these really healthy boundaries and realize that we never put in more effort than our clients or patients. and even better, to not hire on clients or patients who are not invested in the work, don't care about the work, or really truly don't have the ability to rise to the occasion for whatever reason there is. Maybe they need to have a different professional work with them before they actually enter therapy, like getting off alcohol and drugs. That would be most helpful in those situations. So I want you to keep that in mind, because what we have to offer can be really life-changing, but only if we keep appropriate boundaries and let our clients and patients know what our responsibility is and what the client and patient's responsibility is in the sessions that we conduct with them. Be really clear and be okay with them getting angry with you. Getting angry, especially for a client or patient who hasn't shown any emotions in ages, is healthy. I celebrate it, and I let them know that, because a big part of getting them to transform themselves is learning how to feel emotions again. And then, of course, they get upset with me because I don't know how to deal with those emotions, and I have to teach them how to do that too. But that's what makes the work interesting. I do offer a 2-day VIP, totally online, one-on-one program with a 12-month mentorship to teach you how to effectively and quickly transform your patients' lives with hypnosis and neuro-linguistic programming. If you're interested in learning more about it, in the description down below, you'll find my contact information, and then we can have a consultation call regarding what's involved and how you can get started if you're interested in it. I can tell you that I've had many people come through that program and they really, truly love it. So if you're interested, let me know. I only take on one trainee per week because it is intensive. And of course, I have to be able to give the mentorship when the trainees need the information. So I can only service so many people. But I do love doing it, and I do want all of you to be able to truly help your patients heal, not just manage symptoms with endless sessions and toxic medications. All right, thank you so much for spending your time with me. Till next time, bye-bye all.